Creatine kinase, often abbreviated as CK, and CK isoenzymes are crucial components in the medical field. When we talk about tissue location, CK is found in the highest concentrations in skeletal muscle, heart muscle, and brain tissue. CK isoenzymes consist of two subunits, M for muscle and B for brain. Each CK isoenzyme is a dimer with three possible types: CKM, also known as CK3, CKMB, or CK2, and CKBB, which is CK1. In serum, healthy individuals have CKM as the major isoenzyme and a small amount of CKMB, less than 6% of total CK, whereas CKBB is not normally detectable. CKMB increases are associated with heart muscle damage, and elevations are indicative of acute myocardial infarction, or AMI, when used in conjunction with other markers, such as troponin. However, CKMB also increases in other disorders, such as skeletal muscle damage. CKMM increases are associated with skeletal muscle and heart muscle disorders. CKBB is elevated in central nervous system disorders and tumors of various organs, including the prostate gland. The clinical significance of CK cannot be overstated. Elevations of total CK in serum are associated with cardiac disorders, such as AMI, and skeletal muscle disorders, like muscular dystrophy. Occasionally, elevations are due to disorders of the central nervous system, including seizures and cerebrovascular accidents. CKMB values greater than 6% of total CK are suggestive of AMI. When AMI is suspected, troponin is assayed in conjunction with CKMB, and sometimes myoglobin is assayed. Following an AMI, CKMB levels rise within 4 to 6 hours, peak at 12 to 24 hours, and return to normal within 2 to 3 days. So, in this section, we'll delve into the test methodology. CK isoenzymes are measured by electrophoresis, ion exchange chromatography, and several types of immunoassays. Immunoassays that measure enzyme mass are more sensitive than activity-based assays. Aspartate aminotransferase, or AST, is an enzyme found in various tissues of the body. The highest concentrations are in the heart, liver, and skeletal muscle, with lesser amounts in the kidneys and other tissues, including erythrocytes. Clinically, AST is used to evaluate hepatocellular disorders, such as viral hepatitis, where levels can rise up to 100 times the upper reference limit. In infectious mononucleosis, levels may rise up to 20 times, and in cirrhosis, up to 4 times the upper reference limit. It is also useful in assessing skeletal muscle disorders and pulmonary emboli. In acute myocardial infarction, or AMI, AST levels rise within 6 to 8 hours, peak at 18 to 24 hours, and return to normal within 4 to 5 days. While AST is not used to diagnose AMI, understanding its pattern can be useful in ruling out other disorders, including concurrent liver damage. The test methodology involves the reaction of aspartate with alpha-ketoglutarate to produce oxaloacetate and NADH. Sources of error include hemolysis, and the reference range for AST is 5 to 30 units per liter at 37 degrees Celsius. Alanine aminotransferase, or ALT, is predominantly found in the liver, with smaller amounts in other tissues such as the kidneys and erythrocytes. ALT levels are particularly elevated in hepatocellular disorders like hepatitis and cirrhosis, making it more specific for liver disease than AST. ALT, along with elevated AST levels, is used to assess liver involvement in the diagnosis of an acute myocardial infarction, or AMI. Unlike AST, ALT does not show significant increases in muscular dystrophy, pulmonary emboli, or acute pancreatitis. The test methodology for ALT involves the conversion of alanine and alpha-ketoglutarate to pyruvate and glutamate. The reference range for ALT is 6 to 37 units per liter at 37 degrees Celsius, and slight hemolysis does not interfere with the test results. Alkaline phosphatase, or ALP, is primarily found in the liver, bone, intestines, spleen, kidney, and placenta. In adults, ALP is mainly of liver origin, with a small amount from bone. Clinically, increased serum ALP levels are seen in hepatobiliary diseases and bone disorders involving osteoblastic activity. In biliary tract obstruction, ALP levels can rise 3 to 10 times the upper reference limit, with higher elevations seen in extrahepatic obstruction compared to intrahepatic obstruction. In hepatitis and cirrhosis, ALP levels rise up to 3 times the upper reference limit. The highest elevations of ALP are observed in Paget disease and during the healing of bone fractures. Decreased serum ALP levels are seen in hypophosphatasia due to a lack of the ALP bone isoenzyme, which leads to insufficient bone calcification. ALP levels are normally higher in children due to bone growth and in pregnant women because the placenta is a source of ALP. The test methodology involves the reaction of p-nitrophenyl phosphate with water to produce p-nitrophenol and a phosphate ion. Sources of error include hemolysis, and the reference ranges for ALP are 50 to 115 units per liter for adults and 54 to 369 units per liter for children aged 4 to 15 years, both at 37 degrees Celsius. Acid phosphatase, or ACP, has the highest concentration in the prostate gland, with lesser amounts in bone, liver, spleen, erythrocytes, and platelets. Clinically, increased ACP levels are seen in media, lab technician preparing samples for testing, medical professional examining test results in a lab. 1. Prostate cancer. 2. Benign prostatic hypertrophy. 3. Bone diseases like Paget disease. 4. Breast cancer with bone metastases. 5. Gaucher disease. 6. Platelet damage. 7. Idiopathic thrombocytopenic purpura. ACP is also useful in forensic cases involving rape, as vaginal washings containing seminal fluid exhibit ACP activity. The test methodology involves the reaction of p-nitrophenyl phosphate with ACP at a pH of 4.9 to produce p-nitrophenol. Sources of error include hemolysis and loss of activity within 1 to 2 hours at room temperature. The reference ranges for total ACP are 2.5 to 11.7 units per liter for males and 0.3 to 9.2 units per liter for females at 37 degrees Celsius. For prostatic ACP, the ranges are 0.2 to 5.0 units per liter for males and 0.0 to 0.8 units per liter for females at 37 degrees Celsius.